All right, so we are getting started. Welcome to everybody who is tuning in live for the introduction to Brain, Breath, and Barefoot. Very special thank you to Kim to help organize, and thank you to everyone who's taking time out of your busy day to spend the next, we'll say 30, 45 minutes or so with me to learn a little bit more about Brain, Breath, Barefoot, EBFA's education, and the upcoming series that we are doing at Structural Balance or MSRI. All right. So as I had mentioned, if you happen to miss when I had stated, the PowerPoint to what we are going to be following through is actually in the handout section. So if you would like to download that, you may absolutely do that. Otherwise, we will also be sending that to everyone who has tuned in. If you would like to get access to that, you can always also email us at education@ebfafitness.com. And then just so you know, all of our webinars are recorded and archived. They are kept on the EBFA YouTube channel, which is youtube.com/EBFA You will find this webinar as well as probably 100 other webinars and videos that we've done over the past numerous years, all related to brain, breath, and barefoot. So as we get started, for those who are not familiar with who I am, my name is Dr. Emily. I'm a podiatrist, a movement specialist here in New York City. I am a clinician by day, or some of my days, and I practice near Central Park, if you're familiar with New York, and I treat patients primarily from a functional medicine, regenerative medicine perspective. I have a very integrated approach with my patients, and every patient that I treat, I am looking at the foot as deeply integrated with the rest of the body from a fascial perspective, a neuromuscular perspective, biomechanically, energy, mind, body, very integrated in my approach. I'm also the founder of EBFA Global, who is obviously the entity that is hosting this webinar and all of the webinars. And then I created the Barefoot Training Specialist certification. This is what is in conjunction with the Brain, Breath, Barefoot seminar that's going to be at MSRI in June. The inventive Noboso, and many other little accolades. So to learn more about EBFA, ebfaglobal.com. So this is in conjunction with the Brain, Breath, Barefoot seminar that's being held June 2nd through 4th in the Chicago area. And what I'm going to do over the next 30 odd minutes is speak to you about how EBFA uses this concept of Brain, Breath, Barefoot into all of our education. Every time I approach my patients, I'm using this mindset or this philosophy through how I look at their movement dysfunction or why they have chronic pain, and hopefully provide something that is maybe from a fresh look or thinking outside of the box or non-conventional that perhaps any of the other podiatrists, orthopedists, physical therapists that they may have seen have not approached their pain or the movement dysfunction from that perspective. I will be speaking about that more. So when we look at Brain, Breath, Barefoot, again, this is really the integration or the marriage of philosophies of how I look at EBFA's education and our Barefoot Training Specialist certification. It is really this unity that is how we should be looking at our patients, at our clients. And what it really is this integration of the nervous system, that being the brain, that could be the central nervous system, the peripheral nervous system, the autonomic nervous system, and how that relates to a interoceptive perspective. Interoceptive, obviously meaning visceral, intuitive, has to do with the way that we breathe, this translation of our internal state, your homeostatic state. I speak about that a lot. And then how that also is combined with exteroceptive feedback, which is going to be the barefoot aspect or this sensory touch perspective. Now, all of this translates how our nervous system, again, is perceiving this state of balance and kind of that homeostatic balance, or allostatic, in a sense that some people will refer to it as allostatic, how that translates into optimal performance of the nervous system, where you could see brain, breath, barefoot. Really the common denominator of that is we're talking about the nervous system. And ultimately it's the nervous system that controls the movement in our clients or in our patients. And the optimal nervous system function is translated through IQ, EQ, and MQ. So whenever I think of optimal brain function in my patients and myself and my family, I think of it from a cognitive perspective, from an emotional perspective, and from a motor movement perspective. That's really how we want to be thinking of optimizing the nervous system or neural function in our clients. So when we think of brain, our brain, we have a big old brain, and our brain, as I had stated, is involved in the IQ, EQ, MQ. And from an evolution perspective, really it was the development of the neocortex and the expansion into the new mammalian brain that gave us a lot of our brain volume. Is really neocortex. So our brain, compared to our ancestors, 3 times larger than a chimpanzee. But what's interesting is that it only accounts for 2% of our mass. So 2% of our mass is actually our brain. However, it takes 25% of our energy. So even though we have a big brain in relation to everything else, our brain is not that big compared to the rest of our body, but takes 1/4 of our energy. This means that, I'm sorry, my puppy is being naughty puppy, but requires 25% of our energy demands. This means that everything else that our nervous system is for, meaning emotional and motor, really needs to be efficient. So I'm not going to go into that too much. Remember, this is an introduction. We go into this much more in depth in the Brain, Breath, Barefoot seminar and in our BTS certification. But this concept of efficiency is huge, and that translates into optimal neural function. So when you look at the brain, the evolution of the brain, the way that we want to look at the brain is that it's broken down into 3 different sections. We have a reptilian brain, which is our brainstem. We have a early mammalian brain, which is going to be our limbic system. And then we have our mammalian brain, which is the neocortex. As I had stated, the neocortex is the part of the brain that really is that higher processing. It gives us the ability to kind of start questioning why, where the reptilian brain, really, that's survival. So like fight or flight, right? So your adrenaline goes up, your sympathetic nervous system, you sense a threat and you create a response. Now, the limbic system, which is the early mammalian, as you get this sympathetic response, it starts to put an emotion to it. So the emotion could be anxiety, we'll call it that, okay? Or PTSD, because you have a heightened sympathetic stress response. So you're in this anxious state. And now your neocortex starts to question the sensation of anxiety or the sensation of being anxious. And now you have well, why am I anxious? Am I feeling always anxious? Is it this? Am I going crazy in it? Right? So you can see how it becomes a little bit more layered. When someone is deep in just the reptilian brain, that is built around survival. Now, the key thing that I want you to take away from this, little pearls that I want you to take away, is that all sensory information must pass through the limbic system from the brainstem. So every sensation, every touch, every shift within the inner ear as light passes through the eyes or your eyes are moving, every sensation that is coming in must pass through your reptilian brain. And it goes from the reptilian brain through to the limbic system, where there starts to create emotion to that sensory. And then from the limbic system, it goes to the neocortex. Okay, so it's just showing how the process of sensory information is critical to higher brain processing. So if we want optimal neocortex, we have to get sensory information. Neocortex is going to be the part of the brain that houses where we control our movement. So your motor cortex is in the neocortex. So in order to get optimal movement, we have to get the sensory because it goes that, then that, then that, okay? So when it comes to the neocortex, the way that your neocortex sees movement is through sensory information. So your brain sees movement through sensory. And the part of the body that brings in sensory information to the motor cortex is going to be very much related to touch and what's called the homunculus. So this right here is a pictorial of the homunculus, which is how the brain sees movement from a touch perspective. And the areas of the body that are the largest bring in or are the most sensitive from a sensory perspective. So we can see that this individual has very big hands, they have big old feet, and big mouths. So the mouth and the lips, the tongue, all of that is obviously very sensory. The hands are very sensory, and then the feet, which is why when you see a baby, if you have a baby or you had children, but I think everyone has seen a child to know that they just put everything in their mouth. They put their hands in their mouth, they put their feet in their mouth, they put anything in the mouth because they're trying to stimulate, and that's really how they read their environment, is through that sensory stimulation. A lot of it, again, is through the mouth because it's one of the most sensitive. So because we're talking about brain breath barefoot movement, we're going to focus on the feet, okay? So when it comes to your nervous system, your nervous system and the sensory nerves are broken down into four main types. Now, your sensory nerves are nociceptors, thermoceptors, mechanoceptors, which are your touch receptors, and then proprioceptors. So the ones that are probably the most common within health and fitness are the proprioceptors, which are the Golgi tendon or the GTOs, the muscle spindles. And then if you've heard of actual, like the joint capsule has proprioceptors. So those are sensitive to stretch, tension, right? So those have a little bit different response than the mechanoceptors, which are also known as haptic receptors or the haptic receptors, which are touch. And these are going to be the ones that we focus on. This is shape, texture, vibration, etc., palm of the hand, bottom of the feet. And then, of course, the thermoceptors, hot, cold, nociceptors, sharp, dull. Okay. Now, when we break them down, you can see that there's two different cortical pathways. So in your brain, you have mechanoceptors and proprioceptors, which are actually called somatosensory receptors, which means they have to do with movement. The others, the nociceptors and the thermoceptors, are actually called free nerves. So they're free nerves, which means they don't have myelin around them, the fat that surrounds the nerves. They're a little bit different. Because we're dealing with movement, we're going to focus primarily on the somatosensory side. If we look at the mechanoceptors or the touch receptors even closer to look at really how unique and powerful the palm of the hand and the bottom of the feet are, is that these can be broken down even further into four. So you have two that are slow and two that are fast. Your slow mechanoceptors on the palm of the hand and bottom of the feet are constantly reading the environment. So let's say if you're standing on a certain surface, they're going to constantly be reading the texture of that surface. This is as opposed to the fast adapting, which will read the response only at the onset. So as soon as you get a trigger of a stimulus, it's going to read it, and then it doesn't care about the rest of the stimulation. Okay, so just knowing that they have a slightly different response. Now, your slow adapting can be broken down into two more. You have SA1, which is a 2-point discrimination. If you are familiar with Naboso, and if you're not, check out nabosotechnology.com. Naboso is a textured insole and a textured training mat that I developed and launched in 2017. And essentially what it does is it's two little pyramids, or it's a bunch of pyramids, but what your nervous system is differentiating is each of those points of the pyramid or the triangle is stimulating the SA1 Merkel disc because it's a 2-point discrimination. Each of these pyramids on the insole or on the mat is actually 1 millimeter apart. So this is absolutely going after the Merkel disc or the SA1. And that is specific to the palm of the hand and the bottom of the feet. Now, your SA2, which happens to be called a Ruffini ending, is skin stretch. So part of our movement and the way that we control movement is when we stand, we get a little bit of a stretch. So, you know, even if you take the palm of your hand and you try to move the skin on the palm of the hand, right? That is a form of a skin stretch. So when you're on a surface that's maybe tacky and you move your hand or you move your feet, that skin stretch is stimulating the nervous system to help you control dynamic posture and balance. Okay, those are the SA1, SA2. Now FA1, FA2, which are the fast adapting, both of these are sensitive to vibration. I'm going to talk about why that is important soon. So you're fast adapting. What I want you to think is vibration. 70% of the nerves in the bottom of the feet are sensitive to vibration. Remember that because that will be brought up again soon. Okay? So that is the brain. Okay, that is a super quick snapshot of the brain. What I wanted to pull out of the brain from this introductory webinar is that everything that goes through the brain is sensory. Sensory lays the foundation to higher brain processing of the neocortex. Movement, because that's primarily what we're focused on right now, movement falls under the motor cortex and the premotor cortex, which are part of the neocortex. So the only way that you can get into those is through sufficient sensory stimulation. Okay? Now, to go into the breath, we get to talk about the nervous system again because ultimately everything is the nervous system. But the breath is going to pull in a little bit more from the autonomic nervous system. Now, the autonomic nervous system is going to be linked to your breath, how you breathe, and how you breathe is a translation of your internal perception of balance. So if you've heard of the term interoception, and if you have not, I believe it's on the next slide. Interoception, yes, so the bottom here. So interoception are actually free nerves that are found within your fascial system. And the part of your fascial system, your spider web of the human body, that contains a greater percent of interoceptors is actually within your visceral fascia. So if you've ever heard of the term intuition or like your gut instinct, right? Gut instinct is really built around interoception. So this interoception or this perception of internal balance, right, is then translated by the limbic system of an emotional state, and then that emotional state is translated into your breath. So if you feel like you're anxious, that's obviously going to change your breath, right? Someone who is depressed is going to have a little bit different breath pattern as well, okay? How this ties into movement and how it's important and how I build it into the BTS education is if your breathing has changed because you have this internal perception of fear or anxiety, that's going to change the function of your diaphragm. And because your diaphragm is myofascially blended into your pelvic floor, this is ultimately going to throw off your core stability. So, and my goal with my patients, even though they come to me with a foot problem, a chronic foot problem, it is always a core problem. And if the core is not stable, I need to be thinking about their breath because of how they're connected, okay? So how we can change our clients' or patients' perception of homeostasis will ultimately influence the way that they breathe. Okay, so just so that we're all on the same page as far as the autonomic nervous system, I'm sure that you guys are quite familiar with this, but our sympathetic, the way we want to think about this, of course, this is your fight or flight. This is going to be the, you know, go, 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 run, run, run. what you do is you get a sympathetic response and a stimulation of your hypothalamic pituitary adrenal axis, your HPA axis. When you stimulate the HPA axis, you get an increase in cortisol, which is, think of it as that stress hormone. So cortisol, even though it's good, we often think of it as bad or overly elevated because of chronically elevated cortisol can lead to central adiposity. It actually leads to hippocampus dysfunction, and it can actually shorten your telomeres. So lots of negative things from chronic cortisol stimulation. So we can think of the sympathetic state as this gas pedal to the heart rate. All right. Parasympathetic now, this is your rest and digest. Obviously, this is the opposite direction. This is where you can start going into your vagus nerve. So if you're familiar with the vagus nerve, this is definitely something that will be spoken about at the Brain, Breath, Barefoot seminar. Dr. Lois Laney, huge in vagus nerve and all of the cranial nerves. So you're going to get your fill of that. When you look at the parasympathetic, again, 80% of the parasympathetic is the vagus nerve. This 70% of the vagal nerve branches link to interoception and emotion. So again, you could see how these start kind of paralleling many layers. This is the brake to the heart rate. So if you are familiar with heart rate variability, measuring heart rate variability in your clients or in patients is actually a marker of the state of their autonomic nervous system. And when you measure heart rate variability, the higher the variability and the higher their interbeat interval is, right? So they have higher variability. It's actually showing that they have higher vagal tone and they have more emotional flexibility. So the more you can get your autonomic nervous system in check, the more you'll be able to get your breath in check, and then hopefully you can bring stability to that core. So we speak about diaphragmatic breathing a lot in the workshop, and the way that I like to look at it is not just from the sympathetic, parasympathetic approach, but also from some of the common complaints that maybe the clients or patients are presenting with that another practitioner hasn't paid attention to, or really maybe listen to them when they might bring it up. You know, having chronic acid reflux is not normal. And that does not mean, okay, just go get a prescription for proton pump inhibitors and then that's it. Like, there's a root cause to why you have acid reflux, or you have Barrett's esophagus, or you have GERD, right? Is what's going on with that client or that patient's diaphragm. And then the diaphragm, what's going on with the autonomic nervous system. Okay, if they snore, they have sleep apnea, they have a deviated septum, they're a mouth breather, you can hear them breathe. Diaphragm dysfunction, you got to start looking at what's going on there. Urinary incontinence, of course, that's breathing, that's connecting diaphragm to pelvic floor. And then if they have pain during sex, particularly for men, I always ask that question with my patients because that is a huge one. That again, it's something that's, you know, it's like, I don't know, voodoo or whatever you want to call it, where people are embarrassed to bring that up. They might not think it's connected, but you would be surprised the amount of connection that I see in my male patients of chronic foot pain. I know to ask this, and the number that actually admit that and say, like, why, I didn't know that that was connected, or who would I think that I would mention that to, right? And then that's something really important to help them with as well. That's a pelvic floor, lower deep, oblique dysfunction in those patients. All right, so we can use breath to help our clients and patients from a pain perspective, right? So I'm sure that some of the clients that you're dealing with have chronic pain. And when you have chronic pain, that's clearly going to start affecting the emotional state, which is going to affect the breathing. And then it just kind of snowballs into something. But you can do what is called analgesic breathing, where if you take a deep inhale and hold, so you do a diaphragmatic breathing, hold the breath, subdiaphragmatic, you will actually downregulate the nervous system, but it'll affect the baroceptors, which can actually decrease their perception of pain. So if you have a more supra-diaphragmatic breathing style, you can experience what's called allodynia, where allodynia is a heightened sensitivity to pain. So something that is not painful or should not be that painful is extremely painful to that patient or to that client. Anytime you see that, you always want to think, okay, something may be going on with their breathing pattern and why they're getting this kind of allodynia state. I see that a lot in patients as well. The last section that I want to go into is connecting brain breath to barefoot. And when we speak about barefoot, we want to know that we're, you know, mobile, ambulatory, right? So we want to be bringing the information of the brain and the sensory and the movement and the breath and the emotion into human movement. And the most functional movement that we do every day is going to be walking. So the sensory stimulation of walking and the unique demands of walking is, can you guess? Ground reaction forces. So if you said impact forces or ground reaction forces, that was perfect. Now, what I want to ask you next is, if the sensory stimulation of walking is impact forces, then I ask you, what is the actual stimulation of impact forces, right? So every time your foot hits the ground and you experience these ground reaction forces, what is the actual trigger into your nervous system? So if you're thinking in force or pressure or pain, what it actually is vibration. So impact forces and ground reaction forces are built around vibrations. So every time your foot strikes the ground, the fast FA1, FA2, remember from earlier, mechanoceptors are perceiving the vibration. Now these vibrations, as they come in, are essentially giving your body the potential energy to take your next step, right? So impact forces and ground reaction forces are potential energy. And the way that you load the impact forces to give your body the energy to take the next step requires you to load or damp or stop the vibrations as they're coming in. The way that we stop the vibrations as they come in are through what's called isometric contractions. Now, when you create isometric contractions, and I know you guys can appreciate this because you have a big fascial background, is the isometric contractions create a tension throughout the fascial system. So there's this integrated effect of isometric contractions to stop the vibrations, and it has an effect on myofascial tension, stiffness, and intracompartmental pressure. So having and understanding that coordination is what puts the potential energy in the fascial tissue. And then when you take your next step, you release elastic energy, and that elastic energy that is released with your next step that you take is housed within your fascial tissue. Okay. Now, what's interesting about your fascia is that it houses 100 million sensory nerves. We had Robert Schleip speak at the last Feet Fascia Functional Movement Summit that I held in January in London, and he's incredible if you guys are not familiar with Robert Schleip. And what he was speaking of is stating and validating this 100 million sensory nerves. So your fascia is really an extension of your brain. And it's an extension of your nervous system and it's an extension of your brain, which brings us back to brain breath barefoot, right? So when I teach my workshops and when I try to explain it to my patients, I want them to understand and to appreciate the fascial system. The fascial system is packed with sensory nerves, and really it is the stimulation of those sensory nerves that ultimately controls the movement through the motor cortex. And the limiting factor in the control of dynamic movement is the perception of impact forces. So what I often go into in my workshops is when we think of shoes, because almost everyone wears shoes, and if we put lots of cushion in our shoes, now that we know that impact forces are vibrations, it can give you a little bit different insight into how the cushion of shoes is actually going to take away or damp the vibration that's coming in before it even makes its way to the nervous system, where we actually don't want our shoe to absorb the vibration because it's taken away your nervous system's information. If it takes away your information, how can you create an accurate motor response, right? Because sensory is required for motor. And so understanding that and looking at footwear and movement from that perspective helps to bring a little bit different insight into how we're advising our patients to wear shoes, what shoes they should be wearing, the benefit of wearing more minimal shoes, why we need to get barefoot stimulation into our lifestyle, every day, what I call it barefoot before shod, stimulate those nerves so that we can keep our nervous system tuned in, is essentially what I call it, and tuning in. So everything is a stimulus. Sound is a stimulus, and sound is vibration, right? So you can either tune into a sound or you can tune it out. If you live in an urban city or environment, you start to eventually tune out the traffic and the sirens and the honking and things like that, where think of stimulation the same way. When people chronically wear shoes, they essentially start tuning out the stimulation of dynamic movement from the ground up and through their feet, right? So you start to create this disconnect, or you create the coordination and control of motor programming just without ever factoring in your feet, which means you're missing a big piece of the puzzle. Will you still have controlled movement? Yeah, but from a millisecond or a micro perspective, you're delayed, you have a discoordination, you don't have the full picture, so it ultimately can start leading to higher accumulative injury. So last thing that I want to go into related to the foot is that the mechanoceptors in the bottom of the nerve, remember 70% of them are sensitive to vibration. So we need to keep that vibration coming in. The peak sensitivity of the nerves in the bottom of the feet is age 40. By the time you are 70, you need twice the amount of information to create the same response. So as we age, any of our aging clients or patients or baby boomers, or if they happen to have Parkinson's, MS, post-stroke, diabetes, we need to be getting them out of the shoes, and we need to be stimulating their feet through barefoot stimulation. They need to be getting vibration. So if you're familiar with power plate and getting whole body vibration to be stimulating these nerves is extremely important. That's really another reason why I created the Naboso insoles, is to provide and to help these people tune into their feet if they have to wear thicker shoes, or if they refuse to switch to more minimal shoes. This is how can we make tuning into their feet a reality based off of what they're willing to do, is essentially, right? That's kind of the reality when you work with human beings, is you got to work within the scope of what they'll allow you to do. So the way that we can put this all together, and the way that I want to help you put this all together, is through the Brain Beth Barefoot seminar series. And this is with Dr. Lois Laney. If you are not familiar with who Dr. Lois Laney is, she is the founder of Restorative Breathing. She's out of Phoenix, Arizona, and highly encourage you to check out her work. Her website is restoringbreathing.com, I believe, and she looks at everything cranial nerve and autonomic nervous system. So she resets the cranial nerves everything is built around breathing, of course, because your internal perception of balance is translated through the sensory stimulation of all the different cranial nerves. So and all of this starts from when you are first introduced to this world. You may say that that was at birth, but technically it's intra-utero. You're still being introduced to different stimulation. So an example of her work is, let's say if you have a client who gets very nervous or has like a fear response to inversion. They just hate being inverted, right? Dr. Lois would state that during the birthing process, when they were going through the birth canal, there was some sort of traumatic event that, because that's really the first moment that you are being inverted, that they're actually holding on to. So she resets the nervous system and the cranial nerves so that when they're in this inverted state, their breath doesn't change, so they find kind of peace within it, and then their breath, and then they're able to maintain a proper breathing pattern. A lot of us hold our breath or change our breathing patterns based off of different stimulation, and we don't even realize it. So her work is fascinating. And then I will be following the next day and a half, because she's essentially covering the brain and the breast side. And then I'm going to come in with the barefoot side, and then just my take on how I use brain breath and how we combine that with our patients. June 2nd through 4th, 2018. You can learn more information through MSRI. And if you want to learn more about EBFA and our education, which is part of this series, but if you perhaps cannot attend that training and you want to learn more through our YouTube channel, through our blog, through our different social media, we have online courses. So we have plenty of information for you to continue exploring this concept of brain breath barefoot, and how I look at barefoot as a sensory perspective. So to me, the human foot is the gateway into the nervous system. It's a very sensitive neuromuscular aspect of the human body. Yes, I look at it from a biomechanical perspective, but in my experience and in my opinion, sensory trumps biomechanical. And that's what I'm trying to change, the way that practitioners around the world look at the human foot. It's not just about pronation and supination. There is a massive mechanoceptor fascial gateway that's coming through the foot. So if you guys have any questions on the information, please, type those in. You can go to the questions tab here under the control panel and type in your questions. And then if you don't have any questions and you want a recording of this, you can absolutely email me at education@ebfafitness.com. If you want the PDF and you are not able to download it, please email me education@ebfafitness.com. Do check out the website and the YouTube channel, and please do check out the Brain Breath Barefoot series. It will be 3 days that I know will change your practice, change your career. Dr. Lois Laney's, as soon as I went through her program, that next Monday, I just completely started looking at all of my patients differently. And now I can't look at any of my my patients now without looking at breathing in a different way, not just, are you breathing? Are you doing diaphragmatic breathing? But a lot of the things as far as like the deviated septum, the snoring, the audible breathing through the mouth. There was a lot of other things that, she took it to the next level. So, you're very welcome, Claudina. Question as far as what I feel about reflexology. I actually love reflexology, and it's one of my career goals is to actually go through the reflexology program. I'm a big believer in it for myself. I go to Asia a lot, and every time I'm there, I do a ton of reflexology on myself. But for my patients, I will actually send them a lot to reflexology and acupuncture. So both of those, huge, big believer in it. Another question is, hello, Dr. Splichal. I recently had a stroke and recovering from it. Wow, that's good. Toe spreaders into my feet when doing functional movements. What kind of workouts do you bring to proprioception, movement patterns, and vibration sensation? So most of the training that I do, and for those who do attend the training or eventually go to one of my trainings, is everything I do is barefoot, of course. Essentially everything is built around what's called foot to core sequencing. So my philosophy is that you need to activate your feet. The way that I activate the feet is through what's called short foot. But when I do short foot, as I'm pushing the toes into the ground and engaging the intrinsics of the foot, I am cueing the client to exhale, and as they're exhaling, they're doing a focused contraction lift of the pelvic floor. So that would be the foot to core activation pathway. So toes down, arch lift, pelvic floor lift, exhale, diaphragm lift. Technically the pellet would lift as well. So that's the sequence that's built into then every exercise that I do is single leg. So I believe that foot to core activation and foot to core coordination needs to be performed on a single leg. And then all of those are through dynamic movement, triplanar. So all of those, some of those are on YouTube. So if you want to check those out, Doug, you can see those on the YouTube channel, or anyone else can. And that's really how I build it in. So I do it on the Naboso mat, I do it on the power plate, I do it just on the flat surface. It's barefoot, it's foot to core, it's single leg. And it's isometrics as well. So that was a very good question. Good. Create excess tension in the pelvic floor from recruiting it. How do you avoid creating excess tension in the pelvic floor when recruiting it every time short foot exercise? So IQ, a tension is strong but relaxed. So it's a relaxed tension. Think of it as a 15 to 20% of your max contraction of how much you should be engaging the foot, how much you should be engaging the pelvic floor. And then as it translates into the deep rotators and other core stabilizers, think of it as 20%. So it should definitely not be maximum contraction of the pelvic floor. We know that that's not good. That can actually create irritation of the pudendal nerve, and trigger points within the pelvic floor. So everything is very much in a relaxed contraction way versus maximum contraction. So I hope that that answers your question. Yes, you got it. You are so welcome. Good. If there are not any other questions, those were very good. Anyone else? Good. Okay. Thank you guys. If you happen to think of a question, listening through it again, feel free to email me and I will be more than happy to email you back. And last thing, if you're on any of the social platforms, you can, of course, follow EBFA on any of those social platforms. Thank you guys so much. Have an amazing night. And I will hopefully see you at the Brain Breath Barefoot series or on another EBFA webinar. Thank you all.